Hi, and welcome to the Skincarma Pod. I'm Carmine, the creator and voice of the Skincarma blog. With more than 25 years in beauty as a brand builder, copywriter, and skincare junkie, I'm putting my product wisdom and expertise to work demystifying skincare. Today on the Skincarma Pod, I'm excited to welcome Dr. Rohan Shah. Dr. Shah is a dermatology resident at Penn State's Milton S. Hershey Medical Center, where he's blending rigorous clinical training with a clear passion for skin education and advocacy. That passion is coming through on his social channels at Healthy Skin Doc, where I first met him. I love energetic, passionate people, and Dr. Shah's enthusiasm and embrace of skin health really stood out to me. I knew I had to have him join me on the podcast. Whether he's breaking down the science behind acne, myth-busting skincare trends, or sharing life on the inside sporting his white lab coat, Dr. Shah is helping demystify skin concerns and what your skin needs to be healthy. I'm excited to dig into what drives him, what he's learning on the front lines of patient care, and how he's building trust in a space that desperately needs both clarity and compassion. Let's get into it. Let's talk to Dr. Shah. Dr. Shah, hi.
Hi, nice to meet you, and thank you for having me today.
Oh, thank you. Welcome to the Skin Karma Pod. Are you cool if I call you Rohan? We like to keep it informal
Absolutely,
here.
absolutely. When someone calls me Dr. Shah, I'm like, am I even a doctor yet? It feels so formal.
Yeah.
I prefer people calling me Rohan.
Well, I
Anyway,
feel like you're going to have to get used to that.
yeah, that
Right?
yes,
Or Healthy Skin Doc, which
that's
we'll get into.
that's true.
Um, all right, so let's hear about you. Tell me who you are. Share where you grew up. Like, what inspired you. How you got to where you are. Like, you're a dermatologist.
Yeah. So not yet. I'm a dermatology resident.
Yep.
But grew up in New Jersey, born and raised,
Hmm.
and then was able to go to New Jersey for undergrad, also for med school as well at Rutgers. And then from there, I did my intern year down in South Jersey near the Princeton area at Capitol Health. I just
Okay.
finished that actually last week. So wrap that up, and now I'm at Penn State for my dermatology residency. So that starts on July 1st. And I know Penn State very well because I did a rotation there
Hmm.
during my fourth year of medical school. So I'm very familiar with the people. I was there for a conference after I matched, actually. So I kind of already knew, who I was going to be with. So I went to a conference there. I met everyone there. So super excited. And so I started July 1st. This past week has been just adjusting to the new state, to the move, but super excited to get started.
That's awesome. So, did you always want to be a dermatologist? My guess is you probably didn't.
Yeah, I didn't. I didn't actually. So,
Yeah.
there's one thing like growing up. I think that in South Asian culture, there's this whole thing where parents always try to ensure that their kids become doctors or lawyers or whatever. I was actually fortunate that my parents didn't do that. They told
Mm.
me like do whatever you want, and I think because of that, my passion and interest for medicine grew very organically. And so in middle school and high school, I figured out that I wanted to be a physician. I didn't know what type.
Okay.
Then once I was an undergrad, once I started medical school, I dabbled in a few things. Like I remember liking internal medicine a lot. I liked
Mm.
anesthesia. But then there are a few experiences across my childhood because I grew up with eczema, severe eczema, to the point where I would see the dermatologist a lot. And so I think that was sort of like in the backdrop. And then I did a lot of cool projects um, during undergrad as well as the start of medical school that got me into dermatology. And then I met a lot of amazing people there. And then that sort of started my path towards exploring dermatology.
Oh, that's so fascinating. And the fact that you had that experience as a kid with eczema
Hmm.
and it kind of planted the seed, right? We talk a
Yes.
lot on the podcast when I'm talking to guests about where the seed came from. Like for me, I didn't just appear as a writer. Like I had this one teacher in high school, might happen to be my English teacher, who was the first person who really saw me for who I was, and I wanted to please her. I wanted to be her best student. And I became a writer because of that. And it was that seed. And it was like, and I would like go home and I would write letters, as crazy as it sounds. I would write letters to my favorite soap opera actors and actresses and send them in to CBS television studios. And I would get responses, because I
Whoa.
was a really good writer. And,
Yeah.
whatever I asked for, they would give me. And so I was like, okay, I'm kind of good at that. Maybe I'll do that. So I completely relate to that. So like in retrospect, are you thinking to yourself, your eczema was caused by X, and had you known, you would have treated it, you know, a different way? Or like how does that manifest now in your head?
So it's funny because I actually still have eczema. And
Oh, wow.
eczema, if you're aware of, the sort of the pathophysiology of eczema, usually it's a childhood disease and then goes away
Okay.
by like teenage years, by like my age, early 20s, right? But for me, actually, my eczema started later on, like in my early teen years.
Mm,
And then it just continued to worsen. Actually, the peak of it was in college, which is unique. And now there's been a lot of research where now age distribution for eczema is changing towards my sort of experience. And I think, for me, I started off with like topical medications, and eczema to dermatologists is like bread and butter, quote unquote,
right.
because like you
Yeah.
see that all the time. But it's
Yeah.
a very complex disease. There's so many different triggers, so many different manifestations. Obviously, someone of skin of color, it looks different as well.
Right.
Which I know we're going to probably talk a little bit more about. So it was definitely a struggle to manage it. And so then I actually got started on a biologic, which helped tremendously. And I'm still on that biologic. And now my flares have definitely decreased, if any. There were still a few complications initially, but I've had the whole experience because with this specific biologic, there's a 10% chance that you get like eye issues. And so I was
Oh,
actually unfortunately part of that 10%. So that was also annoying, but then we figured it out and with the dermatologist. And so that was
ah,
kind of like I think that kind of also helped because if all of my symptoms and my interactions with the dermatologist were early on in life, like before I was like middle school, I wouldn't be able to actually appreciate it. But
yeah.
now that I had those experiences in college and even started medical school, I got to really actually appreciate it a lot more.
That's so interesting. So you talked about the fact that you're in residency. I don't want to assume, I barely know what that means. Like I'm a writer, I'm like doing other things. Like talk to me about what that means and where you are in your progression to becoming, Dr. Shaw.
Right. So I'm a doctor. So basically, what happens is that you, after undergrad, so after college, you go to medical school.
Okay.
Nowadays, it's super competitive to get into medical school. So people are taking gap years, they take research years, whatever it is. But then once you get into medical school is 4 years. In your first 2 years, you're literally just sitting at your desk, studying your butt off 24/7. Then third year comes along where you're on rotations. And so you're constantly getting exposure to different fields. And this is where people start to figure out, oh, hey,
Ah,
what?
okay.
Surgery's not for me. Hey, I love dermatology. Hey, I don't like this. That's when people figure it out because then by the end of third year, you should kind of know what you're going into because then you
Yeah.
have to take your board exams and then you apply in your fourth year. So now dermatology is a different story because dermatology is also one of the few specialties that's ultra competitive. Like everyone and their mom wants to get into dermatology. And so because of
Really?
that, yes. So it's the most competitive. People who get into dermatology are usually the top of their school, top of their class. And even that's not enough these days. Most people, I would say, like I think the stats are like 60 to 75% of people now take research years because they're still, even regardless of being top of their class, they're still not competitive enough. They have to do an extra year where they're doing only research because you have to publish a lot to be a competitive
Ah,
applicant these days. And so that usually is an extra year or so. And then that being said, still it's very, very, very difficult to match into dermatology. But so the way dermatology works, it's total of 4 years of training. The
hmm.
first year is called a prelim year, so it's intern year. And once you graduate medical school, so last year, once I graduated medical school, I'm considered doctor, right? So I'm
Okay.
Dr. Shah. Um, so in your first year, you're doing internal medicine training. So you're getting a back like exposure to cardiac issues, pulmonary issues, which are actually really important for dermatology. So you do that 1 year. So I just did that. And now my next 3 years are fully dermatology. So I eat, sleep, breathe dermatology  24/7. And so once I've finished these 3 years, now I'm considered a board certified dermatologist.
Oh, thank you for defining that. Okay.
So
I mean, yeah,
a resident is basically a physician. So
yeah,
we all have our MDs or DOs, whatever the title is.
yep.
Um, we're doctors, and now we're doctors in training. So we are now in our specialty of choice and training for 2 years, 7 years, whatever it may be for that specialty. Once we've graduated that, then we're board certified.
Got it. So you're seeing patients,
Yes.
right? How long have you been seeing patients in this process?
So during my basically my away rotations, which were in fourth year of medical school, I was
Hmm.
seeing patients,
Okay.
some at Penn State, some at other institutions, and then in my intern year, my first year, my whole last year, I was seeing patients, but that was more in the hospital setting, so there were a lot more sick patients. I got to see some derm patients when I was on like electives, so that was cool. But a majority of the year was seeing sick patients that are in the hospital.
Like have ailments that
Yes.
have nothing to do with, needing to see a dermatologist.
Yeah, some of them did,
Okay.
but that was not their primary issue.
Right. Okay, got it. All right,
Yeah.
so what's an average day look like for you now?
Yeah.
Obviously, you've just shifted into something new. So, maybe what has it been and what do you think it's going to be?
Yeah, so I got my schedule actually a couple of days ago, and
Oh,
honestly, like I said, I've worked at Penn. That's kind of the reason why I ranked Penn State like very highly when I was going through the whole process of applying because I was there for a month, over a month, and I got to see how everything works. I got to see the people, so I know what the day to day is. So usually, the beauty of dermatology is that usually there's no weekends, which is good. So it's Monday through Friday, and even Monday through Friday, we get 2 academic half days. So basically, we don't see patients. We're at home. We're usually studying, but you could
okay.
use that time to whatever do anything else you wanted. So typically, we're working 4 days a week, and those 4 days, the beauty of dermatology is it's so varied. You can see pediatrics, you can see things under the microscope, so that's dermatopathology. You can do cosmetics, you can do surgery, and then of course there's regular medical dermatology. So there's so many things. So our week is very varied. So I know, for example, like my Mondays, I think are like more cosmetic based, and then like Wednesdays are surgery based. Thursday, we have something cool called continuity clinic, which is basically you see that same patient every like they usually have complex diseases. You
Hmm.
see that patient every Thursday or however many Thursdays it takes for them to actually get them cured. So that continuity is really cool here at Penn State. So it's very varied, very mixed. Usually the hours are around like 8 a.m. to 9 a.m. is lectures, and
Oh,
then 9
wow.
to like 5 p.m. is seeing patients.
That's cool. So it's mixed and obviously it keeps you interested and engaged.
Yes, yes, because like, I think that again, right, the beauty of dermatology, there's so many different
Yeah.
variations. So
Yeah.
whether like some people may not like one thing, but they may have an interest in like pediatrics, for example. So you
Yeah.
get that steady dose every week. Surgery is a big thing in dermatology. So we have like a dedicated day just for surgery.
So have you kind of decided what you want to specialize in?
Yeah, that's a good question. So right now I'm actually keeping my sort of everything open because I'm just starting. I
Yeah.
do have certain interests, like I do like the medical side of dermatology. Like I love your eczema, psoriasis. Obviously, having personal connection to that. My dad has psoriasis. I
Hmm.
do also like hair loss. There's a big, that's a
Oh,
growing field
wow.
within dermatology. So I do like those areas. I also like the idea of like cosmetics. I don't think I could do only cosmetics. I would like to sort of combine it
Yeah.
with medical dermatology. And I love procedures. So I love doing like biopsies. I love like looking at. I love when I was doing like some rotations. I was able to do lasers. That was pretty cool to me as well. So I'm definitely a hands-on person, but I also like to take a step back, use my brain, think
Yeah.
about a diagnosis, especially when it's like your non-traditional diagnosis, like not your acne, but like something very intricate.
Yeah. Oh, so let's talk about that. Let's, shift to skin concerns and what you may be seeing. So, what are the most common skin concerns? You alluded to eczema being the bread and butter. Are you seeing eczema constantly? And then, what else?
Yeah, I mean, eczema, psoriasis are definitely big ones.
Hmm.
Acne, of course, right?
Right. Yeah.
But then there's like a lot of different random conditions, right? Like you'll see like hyperpigmentation, right? A pregnant woman with like dark spots on her on our face. Why is that? That's usually melasma.
Right.
Right. So treating hyperpigmentation, hair loss is a big thing, nail diseases, hair diseases. There's so much variation. Then warts. So with warts,
Mm.
like there's this ever growing constant. I actually published a paper about this like new option that we could use for warts. But there's this constant thing in the dermatology field where we think we found something for warts and then it doesn't really work. And then we have to go back to square one. So right now the mainstay treatment is like using liquid nitrogen, and you
Right.
spray it. And I find it super fun, because it's kind of like a little toy that you can like shoot. Um,
That's a thing that makes it cold and then it falls
yes.
off?
Yeah,
Oh
yeah,
my
yeah,
god.
yeah. So that's the issue though with that is that more often than not the wart comes back.
Oh,
But
right, okay.
yeah, so there's the warts, there's in there's like hyperpigmentation I mentioned, and then there's of course skin cancer, right? So with
Right.
skin cancer, especially in this area, there's a steady Caucasian population. So with that, we get a lot of skin cancers. So actually, Penn State is one of the bigger programs that is specialized in skin cancer and skin cancer surgeries, which is called Mohs surgery. So
Right.
um, we see a lot of patients like that as well.
What does skin cancer look like?
So skin cancer, there's a lot of different types of skin cancer,
Yeah.
but there's three main types. There's squamous cell,
Mhm.
which is like crusty, kind of like ugly looking. It's like very hyperkeratotic, so scaly, crusty, yellowish. Um, then we have the basal cell carcinoma, which is kind of like the pretty one. It's like pearly pink, has like these vessels over it, kind of like shines, kind of glistens a little bit. That's second type. And then the third type, which is the most dangerous type, is melanoma, which I'm sure
Mhm.
you've heard of. And that
Yeah.
one, we call it like the ugly duckling sign. So like if people always have like little brown spots, black spots all over their body, but if there's one that looks a lot different than the others,
Mm.
that's something you may want to get checked out. And so
Wow.
melanoma, I think like so there's this mnemonic called like ABCDE. It's like a good way to differentiate. Like it depends on asymmetry of the lesion, whether there's irregular borders. B for borders. C is color. So if there's like a lot of different colors in that lesion, that's also a sign. D is diameter, and then E is like constant evolution. So if it constantly changes over a week or month span, that's also a sign to get it checked out.
Wow. So, I mean, that's obviously the difference between, I guess, a melanoma and a mole, right? Like, it's changing, it's morphing. That's
Exactly.
so interesting. I've never asked that question, and no one's ever explained that to me before. Fortunately, I'm a huge proponent of sunscreen
Yes.
since I was like 19. And I was fat as a kid, so I never went in the sun. I
Okay.
never wanted to be like out playing in the sun, shirtless or whatever. It
Yeah.
was never me. So it paid off later in life.
Yeah, and also, that brings me to another point. It's like one thing that we do a lot, which I forgot to mention, is full body skin checks.
Mm,
Right? So that just means you come in, you don't have a concern, but we just check you from head to toe. And that's probably the easiest and hardest thing to do as a resident, because it's easy in the sense that you know what you're looking for, but it's
mhm.
also hard because you have to be super thorough, right? Like you have to look
Right,
at every single thing, and you miss one little spot and it could be a cancer. So that's
right.
why, like, I think one of the biggest skill sets that's required in a dermatology resident is being super thorough,
Yeah.
because you have to be constantly suspicious of things.
Where do you see skin cancer most prevalently in patients?
In terms of location,
Yeah.
I would say in sun exposed areas,
Hmm.
so I would say the face, the arms, back of the head, and even places where people that are sun exposed, but people don't think that they're sun exposed.
Right.
So, like for example, the feet, right? If you're wearing
Mm,
slippers all the time at the beach, that's a sun exposed area, and I don't think I've seen that many people put sunscreen on their feet.
right. Or,
So,
wearing sandals and on, all summer long and just,
yeah,
trudging around the streets of Manhattan.
exactly, yeah.
Yeah.
And also, like another misconception is that, oh, it's cloudy. Like today's a cloudy day. Oh, why
Yeah.
do I need to wear sunscreen, right? So that's another thing that sort of pokes holes through the barrier. Like, oh, I'm just going to wear sunscreen when I'm going to the beach, but that doesn't work like that. So
Yeah.
I think because of that, you see in a lot of sun exposed areas. But if people believe that, oh, I'm going to the beach, that's the only time I need sunscreen, then I'm not going to be surprised if I see it on the back or if I see it on
Right.
the chest, because maybe you were like doing your mowing your lawn outside, right? You
Right.
weren't at
Yeah.
the beach, you didn't wear sunscreen.
I have a friend of mine is a dermatologist. She's been on the podcast a couple times, Dr. Jen Haley, and we talk a lot about sun exposure and making sure that you're protecting yourself well. And she said that one of the places that she sees skin cancer most prevalently is in here inside the eye, like in
Mm,
the upper lid, inside the upper lid of the eye, because nobody puts sunscreen there. And she knows that, and we talk about it a lot. She knows that I'm a huge proponent of using sunscreen in the immediate eye area. And she also mentioned for men the back of their ears, because we don't have hair covering our ears.
true.
And I was like, and now I'm like meticulous about putting sunscreen on the back of my ears, of all places, as crazy as that sounds, and of course on the deep inside of my upper eyelid. It's kind of nuts.
Yeah, I mean, and it's areas like that, like you can be as meticulous as you want, but like if you like you said, right, if you miss like
Yeah.
something like this, or a lot of people miss the neck, right?
Yeah. Yeah.
So, and the back of the neck. So like it's those areas that you have to be very, very thorough.
Yeah.
I see a lot of people with like their spray sunscreens, which I mean, they're not. It's been shown that they're not the best because a lot of it just dissipates into the air. And so even if you may be spraying it on your arm, very
Hmm.
little goes actually on the arm. So
Yeah.
you always want to be very careful and just put it everywhere.
I have a sunscreen body spray from Elta MD that I spray into my palms,
Yeah.
and then I massage the palms together and I rub it on my arms before I go on my morning bike rides.
Yes.
So yeah, that's a really good point. So let's talk about, like, you mentioned seeing patients, and I want to understand what your patients understand about their skin and what their skin needs. Like, do they get the basics of skincare, cleansing, moisture replenishment, sun protection? Like, I know I think it was just yesterday that you talked about retinol and this really cool retinol product that you love. That's like skincare, like advanced skincare. But do they understand the basics?
So I f- I think like comparing when I was in first year of medical school and like
Mm,
comparing it to now, I feel like a lot of people have changed recently. I think there's a growing and that's actually one of the reasons why I wanted to get into dermatology is because personal pet peeve of mine is that when I was like in the hospital and when I would tell a patient that, hey, like you have heart disease or you have high cholesterol, you have this, because it's internal, because you can't see it, the
yeah.
patient doesn't really care that much, right? Because they
Right.
can't see it themselves. But a patient will come up to you and be like, "Hey, like I have this little spot on my face. Can you remove it?" Right? And that's
Mm,
what I really liked about it because about dermatology, because people actually care about their skin because it's an external thing, right? People can judge, people can see, people can sort of make diagnosis based off of what they see on your
yeah.
skin. So that's part of the reason why I got into the field. And so I do like when patients are educated, and I do think that patients are becoming more educated. But on the flip side, so I think to answer your question, I think people are aware of cleansers. I think people are aware of sunscreen. Everything in between, I don't think
Mm,
there's a whole variation. Like I'll have patients that come and like, yeah, I know more than like they probably know more than I do because they're like super into it. Um, some of it good, some of it bad. And I think that's where one thing I'm trying to do with my platform is sort of discern the good and the bad, right? There's a lot
mm.
of misinformation out there. Like I know recently, like the beef tallow craze and
Oh God.
do DIY sunscreens.
That
So
is too much. I can't even with that one. And there
yeah,
was some influencer who was really pushing that, making it in her kitchen or some crap, right? Yeah.
yeah. So it's like when patients do know about that stuff, which
Yeah.
is I have to sort of make sure that I, especially this upcoming year now, I have to do even a better job to ensure that I can be mindful of like not obviously hurting any feelings, but also just telling them that that's not the way to go, and that there's so many other options because there's this constant battle that dermatology and anyone in dermatology faces is that you have all this misinformation by people who are not in the field, and everything's anecdotal, right? That maybe that DIY sunscreen did help that one individual, right? But that doesn't mean we rewrite the textbook and we rewrite science just because of one person. And so that
Yeah.
one person disseminating that information then leads to this chaos.
It's so nuts to me. Sunscreen, and it kind of makes me crazy. we haven't really talked much about the beauty world, and we can talk about that in a bit. There's how beauty approaches skin and skin health and the product skin needs, and how dermatologists approach it, from a scientific, perspective. Um, and it makes me crazy that beauty pushes anti-aging products when the top anti-aging product in anyone's arsenal is sunscreen. And sunscreen's the least expensive. I mean, aside from a cleanser, like you can get a really, really effective sunscreen for $15-20. Like, why DIY that? Like, spend your time making retinol
Yeah.
in your
I
kitchen,
agree.
right? How about that?
I agree. Because
That's
retinol now is like 80 to 100 to $150 now.
It's crazy. It's so crazy. And I bet
Ridiculous.
I
Yes.
bet vitamin A costs nothing to manufacture, like vitamin C and niacinamide, right?
Yeah.
Like, come on. So let's talk about your patients. You talked about a high Caucasian population in the area, but you see patients from all walks of life and every skin tone. And we know that treating concerns in skin of color is a much bigger issue and takes a lot more effort. And so, what do you think needs to change in terms of training, awareness, and even product development for skin of color, and how to address concerns of melanated skin?
Yeah, that's a great question. And I think, within dermatology, and no fault to anyone in particular, because it's just the times that we're in, right? So, like 30, 50, 70 years ago, when dermatology was obviously growing and the way it was growing, it was not that there was any racism or anything. It was just that there weren't advancements in skin of
Yeah.
color, whether it's in skin of color technology, diagnosis, whatever it might be, right? There weren't any skin of color images in textbooks. And because of that, residents and anyone training, just it never crossed their minds. And then also, it's a known fact that diagnosing someone with skin of color is definitely difficult, right? Eczema in me is much harder to diagnose in someone who has eczema with skin of color, with Caucasian skin. So the whole
Hmm.
thing is that I think that there is a growing, awareness. There's like Skin of Color Society now, which I'm a part of. I'm actually part of an initiative that brings awareness to skin of color populations. Also, I'm creating an app right now with a few individuals that is geared towards helping people, helping dermatologists, and helping and even the patient get a rudimentary diagnosis. So if they have a lesion on their skin, at least they can take a picture of it and get a diagnosis as to whether it's dangerous or whether it's something that they can hold off for a little bit. And it's geared towards skin of color population. So we sort of received a lot of images to sort of train the algorithm. And so I'm trying to do that, make my own change, and see how I can help those with skin of color, like me myself. But I think the one thing that we need to do is, as physicians, is to understand culturally. It's not just the skin itself, it's more about the culture behind that individual. So I know there's certain cultures that they apply certain things to their skin, and that may explain a rash that you may have
Mm.
never seen before, right? And so I think that's also part of the um, growth that we need to see as physicians. It's not just understanding lesions themselves in skin of color populations, but understanding the culture that may lead to that. And then within technology space, I mentioned some of the stuff that I'm trying to do, but I know, lasers, for example, that's a whole different area where lasers were constantly being marketed for everyone. But now we know that there's certain lasers that can be for Caucasian people and other lasers for skin of color populations based on your Fitzpatrick skin type. Chemical peels, another thing, right? So I think that there's more awareness, and as we get more skin of color dermatologists in the field, that trend is going to continue um, to gravitate towards the right way.
Got it. That's so cool. I mean, I could talk about that for hours. And you mentioned um, acids like glycolic acid, chemical peels, that kind of thing. And I've talked to a brand founder. She's a person of color, and she was treating PIH, and she was using glycolic acids, and it was making it worse.
Mhm.
And she sought a dermatologist who had that expertise, and they said, you have to stop using acids on your skin. That's not. And you know marketing doesn't talk about that. Beauty marketers don't talk about that. They
Yeah.
just market broadly, and a lot of people don't understand that certain actives don't interact well with their skin or could actually exacerbate a situation. So it's so important, and what you're doing on your channel is really key, right?
Yeah, and one thing that I'm really liking is this whole advancement of tinted sunscreens. Uh,
Mm,
because I think now, like every like 3 years ago, I could count on my finger, I'll count on my hand how many companies were actually developing good tinted sunscreens. Now
yeah,
I think that a lot of companies have sort of gone into that field,
yeah.
which is good because the more there are, the more access there is. So you have your high end brands, but you also have your more affordable brands. So anyone and everyone should be able to have those tinted sunscreens that they could use because it was annoying, right? Like
Yeah,
when you use a regular sunscreen, and if you're skin of color patient, you have the white cast, and then you're like, why should I even use this, right?
yeah,
And there's this another thing that we haven't even talked about is this whole misconception that people with melanin skin um, don't get skin cancer.
hmm,
And that's a misconception. And I know, again, coming from a South Asian family, my family, like my extended family, they're like, why do I need sunscreen? Like
oh wow,
I was running around in, India or whatever country it might be, when I was a kid, I didn't have any skin cancers. And yeah, I mean, there is some truth to it that yes, melanin does protect you to an extent,
hmm,
but it doesn't protect you 100%. And
yeah,
also if let's say, it does protect you from skin cancer, which it doesn't, there's other things that you need to that you need to consider, right? There's hyperpigmentation.
yeah,
That's the thing that sunscreen obviously protects you from. Anti-aging, which you alluded to. So it's not just skin cancer. There's a lot of other benefits.
yeah, yeah. So let's talk about the two sides of Dr. Shah, your work as a dermatologist and your online persona. So, how do you balance the evidence-based medicine, in your day job with the world of social media, which is kind of your side hustle? I mean, I get that. That's not what I do for a living. I'm a copywriter and a brand builder in the day. Um, and so in social, there's the trends don't exactly align with science or even the truth a lot of times. Like, how are you approaching that in Healthy Skin Doc?
Yeah, so actually, Healthy Skin Doc started off. I think it started off like January 1st, just as more like a dare because some of my friends were saying that you should do this.
Mm,
I kind of voiced a little bit of like my interest in that, but I never had that push. I never had that sort of confidence boost to do it. And then like I just one day I was like, you know what, New Year, let's do it. Let's see what happens with it. So just started creating like just random videos, educational content, and I saw that a lot of people were gravitating towards it. Initially, I think my following base was a lot of skin of color because I started talking about skin of color,
hmm,
and then once I got involved because I was one of those people that like never used social media, never had it, didn't use it. I remember at the time, my girlfriend at the time was like, you should get involved in social media, like you should do a little bit here and there, and I was very against it, but then
hmm.
I started and then like went from 0 to 100, and
Yeah.
now she's like, "Yo, you should tone it down a little bit." But it's just funny how that works. But I think that once I started making videos, I really realized that there was a lot of misinformation out there, and so
Yeah.
part of my agenda was that I wanted to clear up all this misinformation. And I am someone who's big, big, big into research. Like I love research. It wasn't just something that I had to do to get into residency. It was something that I still do even now, even when I'm already matched into residency. So I'm like kind of like a nerd that way. Like I
Mm,
will go on PubMed and I will search up things, especially before I'm making a video. And the one thing I realized, it's a two-way street. It allows me to teach, my viewers, but it also allows me to teach myself.
yeah.
There's no
Yep.
sort of incentive to just go online and just start like, learning about snail mucin or,
Hmm.
or whatever it might be, right?
Is there
So
PubMed put is there information about snail mucin on PubMed Central?
absolutely, yeah.
Oh my god.
Yeah. They
I use it too in my blog, so
they may not say snail mucin, but they'll say like
yeah.
the actual, the
The
scientific.
Latin term.
Yeah, exactly, exactly.
Oh my god.
But yeah, so that's where it stemmed from, right? Like I wanted to clear up a lot of misinformation. I also think that there's not a lot of skin of color representation in dermatology. It's growing,
Yeah, that's
and
true.
especially males, skin of color males, there's very
For
few.
sure.
So I
Yeah.
wanted to, I think that was like my little niche initially. So I started creating some content for that. And then naturally, companies started reaching out to me and they're like, hey, we'd love for you to create some videos for us. And one thing that I, again, still to this day want to have my sort of content creation primed on honesty, right? So if there's something that I don't believe in, I will turn it down. If there's something that I feel that the research isn't there yet, I will turn it down because at the end of the day, this is sort of like I'm a baby in this career, right? I just started.
Yeah.
I want to make
Yeah.
sure that everything that I choose, everything that I do, everything I sort of promote is all stuff that I firmly believe in that I would use or I would recommend to someone. Um, and so I think because of that, it grew organically. The science behind it kind of touches on it on itself because I do the research
Mm.
behind all these products, and that's also it's kind of made me realize that like what kind of dermatologist I want to be as well, right? Do
Mm.
I want to be that dermatologist that is affiliated with all these companies, or do I want to be affiliated with like one or two companies that I am very actually passionate about that I would use in my on my own skin, and either way is fine, right? Like do you, but I think for me, Healthy Skin Doc has really taught me, what I actually value and then what also people value. Because if you see some of my earlier content, I was just like sort of like lecturing. And that's the kind of person I am. Like I love teaching,
Yeah.
love
Yeah.
mentoring. But then I have to also find that balance that people don't want to scroll. People don't scroll to be lectured. People
Right.
scroll to just be engaged and entertained. So now I'm still
Yeah.
finding that balance. It's difficult for me because I want to be honest with myself. When I started this platform, I didn't want to be fake. I don't plan on doing that ever. I just want to sort of teach people, but also be comedic and have some humor behind it as well, so people
Yeah.
actually engage. And so I'm still figuring it out, but I think once I start this, this year, I think it's going to come naturally.
Well, I mean, that's what piqued my interest. When I wasn't following you, and I don't know how one of your reels was delivered up to me, but I was like, wow, this guy has great energy, you know. So I completely get that, and I try to be energetic, and I do a lot of comedic stuff, because that's who I am,
Yeah,
right? And it's interesting that you talked about how you get product coming your way and you do deep dives into the product before you do anything, certainly promote the product. Um, that's that to me is one of the most fascinating things because I'm in the same boat. I get so much product.
yeah,
And, sometimes I'll shit talk, but usually I just put it aside. I'm like, yeah, that's not I'm not going to talk about that. And so, I like to focus my time and energy talking about products that I really love, and then on my blog talk about products that I really love and go deeper. One of the products, I don't know if you were involved in, I know you've been involved with Skin Fix and the Skin Fix Derm crew. I don't know if you still are. But one of the products that I really love that came out of Skin Fix over the last year is the exosome balm.
mm,
Like I had never look. You're a dermatologist. Like you've heard of exosomes long
yeah,
before the rest of us, but
yeah.
I never heard of exosomes. And like, is that kind of like innovation what you were talking about? Like that is interesting to you, and that really piques your interest.
Yes, because I've said it a long time ago when I matched into dermatology. One of my goals, like a personal goal of mine, is to
Yeah.
create something like that says, Dr. Shah, like create something of mine, right? So I definitely I have a chemical background as well. Like I know a thing or two about like formulations, and so I
Mm,
do see myself in the future creating like a skincare line. And
mm.
with that, I want to be knowledgeable about it. There's the other Dr. Shah, Munib Shah, who
Yep.
everybody
Yep.
knows about, and he just recently created.
Love his brand. Oh
Yes,
my god, those products are so good.
exactly.
And I don't know if he knows this or not. But that one remedy for dark spots, he
Yeah,
has he has three that they're all different levels of retinoids with different actives depending on what they what the target is for that
Yeah.
particular product. But like, I was at an event in the city last night, and I got home at 9:30, which is that's like unheard of for me. Like, I'm home by 7 o'clock,
Yeah.
winding down. I'm in bed at 9, lights out at 9:30. I get up every day at 5, sometimes 4:35. And if I get home at 9:30, like, there's no time for a deep skincare routine. I literally washed my face, and then I was like, "Oh, thank God I have that remedy, because it's got everything my skin needs." And I put that on and I went to bed.
Yeah.
So,
And you can tell, right? If you look at the ingredients, you can
oh my
you can tell
God.
that a dermatologist made that, right?
Yeah,
Like
yeah,
a formulator who just threw random things. And
yeah,
and to do that, to know that takes years, right? It doesn't happen overnight. You have to experiment yourself. You have to see on your patients, hey, kojic acid works. Hey, this doesn't
yes.
work, right? So that's the thing. That's the kind of thing I envision myself. And
Mm,
so by getting all these skincare products, I when I do my research, I'm like, hey, you know what? I like this product. Hey, this ingredient. Hey, I don't like this ingredient so much. So it's kind of like priming me to understand what in down the road, whenever that time comes, what things I want to incorporate in my sort of concoction
yeah,
down the road.
yeah. And textures too, right? Like,
Yeah,
the skincare product development is so fascinating. It's the striking the balance between the experience and the efficacy, I guess.
right, right.
Yeah. Well, let's talk about product innovation and ingredient innovation. Are there new treatments or technologies in dermatology that you see that you're really excited about right now? Like, all of a sudden exosomes are in the public sphere, and consumers know exosomes now. And I know SkinFix likes to say it was the derm's best kept secret, but there was some truth to it because I had never heard of them. So, like, what's exciting you that the rest of us may not see yet?
So I think that there's a lot of big research being done in
Hmm.
hair restoration. There's a lot of technology in that space as well. Now with hair transplants, there's new technology where you can see to the smallest follicle level the hair that you're putting into the shaft.
Mm,
So there's a lot of new imaging, non-invasive imaging. I think is a really cool space within dermatology because now you can see things deep into the skin that doesn't require maybe a biopsy anymore, right? Why take a chunk of you out when you can just do like a non-invasive probe and see what needs to be done and what doesn't need to be done. So I think that's a whole area that I'm very interested in. And I do have like more like a tech background. So I'm very interested in sort of partnering with any of those companies down the road to sort of see how like a dermatologist can get on board and see how we can sort of alter the diagnostic process because biopsies are great, but at the end of the day, right, there you're taking up people's. It's first of all, it takes time.
yeah,
Secondly, you have to send it to a dermatopathologist. That takes time. The dermatopathologist reads it, and then by the time you get it back, it takes some time.
yeah,
And also, of course, a chunk of the patients there and there. So we want to minimize obviously cuts and cutting up people. So I think non-invasive imaging would be something that's really interesting, and I'm something that I'm looking forward to. And then you kind of mentioned exosomes. So
mm,
I think there's a lot of research that still needs to be done. So exosomes, I know, are already being used like post, procedure, which
yeah.
is great. But I think
On
that
compromised skin.
compromised skin. But
Yeah,
incorporate it into your skincare routine, I think there's still literature that needs to be published on that topic.
yeah,
But I'm
yeah,
all for it, right? If there's more targeted delivery, because right now we're using like laser assisted drug delivery, right, which is a cool thing, where you can like use lasers to create channels, and that improves the efficacy of like your topical steroid. Those things are cool, and so if we could use exosomes for that, that would be also very, very unique and would probably be a game changer in your skincare routine.
yeah. I talk a lot about ingredient penetration, and there's just a lot of buzz around things that just don't penetrate the skin barrier topically. I think one of those is growth factors.
Yes.
That there's collagen, like, notoriously massive molecule that doesn't get past the skin barrier. Like, why is it even in this product? So it's a fascinating dynamic world. And I'm glad that you're intrigued by it too, because we need more really smart, educated people bringing, legitimate information to the arena.
Yeah, and I think like, with the advancements in machine learning, AI, the
Mm,
space in general, right? I think there's a lot of utility within dermatology. Like one thing I can think of is for psoriasis, right? And for any medical condition, any dermatological medical condition where there's a biologic that's needed, there's a lot of biologics out there. And so, how do we actually pick the right one so that we minimize this sort of trial and error process? Because I've seen it firsthand where, patients will be just say, hey, you start on XYZ. If it doesn't work in 6 months, come back and we'll start another one. That's
hmm
6 months wasted, right?
Yeah,
We're
yeah,
injecting something that's not been working.
yeah.
So there's now ways that we can use AI and machine learning to sort of figure out, okay, based on your genotype, based on your um, sort of profile, this medication would probably be best suitable for you.
That's so fascinating. That's where we're headed, isn't it?
Yes. Yeah.
Oh my God. And probably sooner rather than later.
Hopefully sooner
Yeah.
than later.
Yeah. Super cool. All right, so let's just end on a lightning round. If you want to just give me one word, you can go in, give a deeper answer if you want.
Sure.
Um, to the following, and then we'll wrap up. Most misunderstood skin condition.
Ooh, misunderstood. I would say eczema.
Okay, cool. I thought you were going to say acne, but eczema will take. Overrated trend.
Overrated trend. I think using toners.
Oh, wow. Like a hydrating toner or an
Yeah.
exfoliating toner? Hydrating toner.
More so exfoliating toner.
Okay,
Yeah.
okay. And why is that?
I feel like toners don't do much.
Hmm
I don't. I've seen the research behind it. I don't think they do too much. I think it's a lot of marketing there.
Interesting.
Hydrating toners, they're decent, but I would say exfoliating toners. Also, like not everyone needs exfoliating toners. I think it's like thrown around and then everyone's using it.
Right,
With
right.
eczema, for sure, shouldn't be using exfoliative toners.
Oh,
Um,
interesting.
Psoriasis should not be using it either.
That's good to hear. Did
Yeah.
everybody get that? I almost never use an exfoliating toner. Actually, the I do. I take it back. I use a glycolic acid toner every day, and do you know where I use it? In my underarms.
Okay.
I
Oh,
haven't used deodorant in got to be 6 years, 7 years now. I
very
use
interesting.
glycolic acid in my underarms. Yep, the
I don't know.
$7 bottle, $10 bottle from the Ordinary,
Yeah.
like that in my underarms. I'm good.
I've heard that it's good for like, on your to apply on your feet.
Oh,
Um,
really?
oh
Yeah,
yeah, for like
yeah,
stink that comes with feet. Um,
yeah.
I've heard that. So yeah, maybe I'll have to try it out.
Yeah, it's wild. Try it. You can go 72 hours. Not that you want to go 72, but you can. I've tested it. 72 hours odor free.
Interesting.
Um, underrated product.
Underrated product. I would say, let's see. I would say an underrated product is retinol because I feel like
Ah,
yeah, because I feel like a lot of people they just think it's like anti-aging, which it
yeah,
is for sure.
yeah, yeah.
But it also has a lot of different benefits besides just anti-aging. So I think that once when people actually understand all the benefits from retinol, I think there's going to be a greater adoption of it.
I feel the same way about niacinamide.
Yeah, that's true. Niacinamide
Yeah,
also has a lot of different
a
benefits.
lot. It's
Yeah,
crazy. It's like a
yeah.
miracle. It's so wild. Acne's biggest enemy.
Acne's biggest enemy, not acne's biggest enemy. Okay, I would say salicylic acid.
Oh, really?
Yeah, I thought you were gonna say acne's biggest friend, and I was about to say like not like cleansing after working out. Uh,
Right.
but yeah, acne's biggest enemy, I would say retinol or salicylic acid.
Okay, cool.
Yeah,
Skincare sin.
skincare sin. Ooh, having like 10 different products in your skincare routine. That's a skincare sin because you think you're doing good, but
Yes.
you're probably doing more harm. Also, a
Yeah.
lot of these products, like for example, vitamin C is great, but it's very unstable if you apply it onto like different things. So you have to be very careful. You can't just be applying 10 different things because there's also something to be said about how those 10 different things interact,
Interact, right?
right? So you want to
And they're
minimize
not interacting in a petri dish, they're interacting in your skin
your skin.
barrier.
Exactly.
Yeah.
And
Yeah.
another sin for your skin is fragrances, using like
Ah, thank
fragranted,
you.
products.
Yes.
It's okay to, of course, like I use perfume, I use cologne, all that stuff, but when on your skin, to use it on
Yeah. It's
directly,
nuts, right? It's
yeah,
nuts.
yeah.
Yeah. Uh, what's your skin type?
Skin like Fitzpatrick skin type?
No,
Oh,
like,
oh, just general.
oily. Yeah. Yeah.
Yeah, I'm more on the oily side.
Uh-huh.
Yeah, I would say more on the oily. So when I use a cleanser, I'm very wary of that. I sweat a lot as well. So when I
Mm-hmm.
work out, like I'm usually sweating a lot, so I have to, pat dry, make sure I use a cleanser afterwards. That's non, I also have very sensitive skin too. That goes
Ah,
hand in hand with the eczema, right? So I have to make sure that I'm not exfoliating, so I'm not using any of those exfoliators. And also when it comes to cleansing, hydration is the most important thing.
I love that you said that. It's so true. And I
Yeah.
think a lot of people don't really pay attention to hydration in their skincare routines.
Yes, and another misconception is that if I drink a lot of water, my skin is going to be hydrated. And
Right.
that is true to an extent, but it's not the full story. If you were to just drink water and not do any hydration to your skin, you're not going to have like great skin, because you need the stratum corneum, which is the top layer of the skin, that doesn't get water that you drink. That can
Right.
only be nourished and hydrated through topical.
Right.
So yeah, that's another misconception that I feel that like a lot of people have.
That's interesting. In the structure of the stratum corneum, that's where the lipids are, right? And the
Yeah,
water doesn't get past the lipids.
yep.
Yeah. Um, so what's your personal skincare vibe? It sounds like you're more of a minimalist.
I wouldn't say I'm a minimalist, because
Okay.
I've seen people who, like, I've seen men in like in dermatology, like, okay, so there's different levels. People who are not in dermatology, who are just like, regular people. I've
Yeah.
seen them just use one thing.
Right.
That I think that's just that's not minimalist. That's just like lack of
Like
knowledge.
we're talking about guys using soap on their
Yeah,
face. Yeah,
exactly.
yeah, yeah.
So I wouldn't say that's minimal, but I know people who are educated in dermatology who use like maybe only 2 or 3 products, which
Mm,
is great. That's amazing. But I think because for me, I have like the sensitive skin, I have these different variables. I have to be a little bit more careful and proactive about it. So I would say I'm right in the middle. Like I would say maybe like a 4-step skin routine. Nothing crazy, but also not minimalist.
right. Not down to the one product like me last night. Uh, how would you describe dermatology in one word?
Fascinating.
Oh, cool.
Yeah.
And let's wrap it up. How would you describe healthy skin doc in one word?
Growing.
Oh, cool.
Or
Love it.
innovative.
Okay, okay. 2 words.
Yeah.
Oh, this was awesome. I really appreciate it. Like I knew I had to have you on, and I really appreciate you giving me the time.
No, I really appreciate you for giving me the time, having me on. Obviously, you're doing great things. I've seen a lot of your stuff. You're very educated, so it's great to be on a podcast where that your counterpart is may not be in dermatology but knows a lot about dermatology. So
We share PubMed Central.
yeah, it's refreshing.
Like that's my ish. Yeah,
It's refreshing to have these kind of conversations, and then hopefully a lot of people watch this and like get sort of
yeah.
inspired in different avenues.
Well, we'll keep it going. Thanks so much, Dr. Shah.
Thank you so much.
Ciao.
Take care.
I hope you enjoyed that. I knew it would be fascinating. I love to wonk out with a dermatologist. Oh my God, it's my favorite thing. Before we go, do me a favor, follow Dr. Rohan Shah on his Instagram at Healthy Skin Doc, and check out his reels. They're really cool and super deep in education and insights about skin health. Thank you for listening to the Skin Karma Pod. Find more insights, real talk, and reviews of my favorite skincare products on the Skin Karma blog at skinkarma.com. And if you're listening on Apple Podcasts or Spotify, please rate and review this episode. It helps me to reach more listeners. Ciao.